You are watching the medical segment of the Jennylyn Show, and I am Jennylyn Gleave, your host. On this segment of my show, various physicians will be debunking myths associated with their specialties and sharing what is new and cutting edge in their fields of medicine. Today, Dr. Aldon Hilton DDS will be debunking medical myths associated with dentistry. Once again, you may be surprised if some of what you have believed over the years are myths. Dr. Hilton has also written a book, The Smart Consumer's Guide to Getting a Dental Sleep Retainer. He makes the retainer he discusses in the book. It's both a night guard and can also treat some sleep apnea cases. Stay tuned and find out if you are a candidate for this device, as well as debunk any myths that you may have believed over the years. And here is Dr. Hilton.
That if you had gum infections primarily, it just retained in the mouth and there were no medical complications. Now that's clearly not the case. People with very bad gums can affect their heart, their health, the amount of bacteria they have swimming in their bloodstream. So now we're more concerned about the quality of somebody's dental health in relationship to their general health. And this is new information, probably about the last 10 years. Tooth decay does not start by worms. That goes back to the real old days of dentistry and probably the Middle Ages when they were, actually if you could see an open tooth and you looked at the nerve, it does, to the uneducated eye, look somewhat like a worm. So that goes way back to the Dark Ages, maybe the 17th, 18th century, where they were looking for an explanation as to why teeth decayed. And of course, when they saw the nerve exposed, it looked like a worm, so they came up with the concept, oh, there's a worm that causes the tooth to decay, and if we could only control the worm, we wouldn't have tooth decay. Of course, that's not correct. Now, gummy worms will, what about gummy worms? Well, there are worms that will cause tooth decay, and those are gummy worms and gummy bears and things like that, especially if the teeth aren't cleaned shortly thereafter. It's that concentration of sugar and carbohydrates that the bacteria like in the mouth, so that's the stuff that eats away the tooth and actually eats away the gum tissue as well. That's not there are several causes of bad breath. Not cleaning the mouth properly and flossing and brushing will cause bad breath. But there's also bad breath from intestinal reasons or esophageal reasons. It's called GERD. And GERD can back up the stomach acid, and this acid can actually get into the mouth. So if you actually were close to someone like that, you would sense that they had bad breath, but it wouldn't be because their teeth aren't clean. It was because they have an acid reflux disease. Other things that can cause bad breath are temporarily, of course, is combinations of garlics and certain foods that leave an odor in the mouth unless the mouth is cleaned thoroughly. So people do have halitosis from alcohol. That's the breakdown of the sugars and the alcohol in the mouth, and they haven't cleaned the mouth. But most bad breath is associated with the mouth needing to be cleaned and flossed, and most of that goes away with that. Folks seem to think that if there's no dental problems, there's no reason to see a dentist. And that's really untrue. That's really a myth. And the reason that is that dentistry is truly preventive. Now, if I'm having no heart problems, it doesn't mean that I shouldn't go get my heart checked and to make sure that my heart is healthy. In dentistry, you can go a lifetime without having many problems and then come into a dentist and be found out that you've got a lot of problems. So dentistry is truly prevented. If you went to the dentist every year, at least, they would check the gums. And one of the things now that we're really finding is that statistically there's more oral cancer. So if you only went in, if you had perfect teeth and you only went in to get your teeth cleaned and oral cancer screening, that's at least a good reason to visit once a year. But almost everybody has tooth decay. 75 to 80% of the people have some gum infections. So there are a lot of good reasons to continue to go to a dentist on a regular basis. A lot of people believe that the water naturally contains fluoride. In municipal areas, it does not. It has to be added. And that's a matter of local policy. And in fact, in the San Jose area, they're fighting fluoridation right now. More people are drinking less public water and drinking more bottled water. And there's no fluoride in bottled water. So statistically, people feel that study these kinds of trends feel that in the future, there's going to be a lot more tooth decay because they're not using municipal water and they're using these pure bottled waters. Fluoride combines with the tooth structure, especially in the developing tooth. Now, topical fluoride still will penetrate the tooth, but if you can get fluoride in the developing tooth, that tooth structure with the fluoride in it is stronger than the one with phosphorus in it. And the tooth is made up of calcium and phosphorus. If there's more calcium and fluoride in it, and not too much, if there's too much, then the teeth become stained, mottled. They can have multiple colors in them. But if there's just enough, and that's 1 part per million, it'll make the tooth a lot harder and less susceptible to decay in the future. So that's the whole rationale behind fluoride. There are a lot of things that people believe that are only bad for their teeth, and that's refined sugars, chocolate, breads, cookies, and things like that. And while in the most part that is true, because those contain the most refined carbohydrates and the highest level of sugars, you can also damage your teeth by eating fresh fruits and vegetables, because fresh fruits primarily have citric acid in them. Wow. So if you were the classic example is someone that sucks lemons. There's an erosion of the enamel on the teeth, and that's from the citric acid, and it's not from any sweet. So it's that combination of acid, and also there are natural carbohydrates in fruit. So that has to be removed as well. But certainly the perpetrators of most tooth decay is not fresh fruits. Most tooth decay is the sticky, refined carbohydrates in baked goods. Most recommendations for brushing one's teeth is about at least twice a day. In the morning after breakfast, brushing and flossing, and if at lunch possible, but if not, then at least the last thing you do before you go to bed. And to use a soft toothbrush. Now, I've been around long enough, I've seen people that have used really hard toothbrushes, and they literally drill into their own teeth. They wear away enamel, they can enamage the gum, and it wasn't long ago, certainly within my career span, when the hard toothbrush was recommended. But you have a soft toothbrush, you could brush your teeth 10 times a day with a soft toothbrush and not wear away any enamel or do any damage. However, if you used a real hard toothbrush, there's likely you would destroy enamel, you would cause your gums to recede. There's been something that's been sort of promoted to the public, and that's the use of a chewing gum that has xylitol in it, and to reduce tooth decay. Now, in and of itself, it won't do that. So if you were to have a meal and you thought, okay, I'm not going to brush my teeth, but I'm just going to chew this gum, and that's all I'm going to do, won't prevent tooth decay. But if you were to chew something and you want to choose gum, xylitol would be a good choice. But if you finish the meal, you would have to brush your teeth, because that's the way you know, brush and floss your teeth, that's the way you know you get all of the biofilm that was created in your mouth, which contains all the bacteria and does all the damage on your teeth, then you know that that's removed. But only brushing and flossing will do that. A lot of people are somewhat concerned about damage to enamel when they whiten their teeth. Teeth whitening is nothing new. It's probably got a 25-year history maybe even longer. And certainly the products that they have out now are very, very safe. So it doesn't damage the enamel, it doesn't erode the enamel. What it does is pull out some of the color that's just below, that's in the enamel and just below the enamel to whiten the teeth. But if you stop whitening your teeth, the teeth would go back to their normal color. So there's no permanent damage to the teeth from doing that. Ever since I started practicing dentistry, there's always been this question about wisdom teeth, molars, the third molars. Do they need to come out? Do they need to prevent things? And it's still an ongoing discussion. There are a lot of dentists that feel, like I do, that it's an optional treatment. So if there is room for the teeth, or if they aren't coming in and there's no symptoms, then a lot of my colleagues and I feel that there's no reason to take the risk to take them out just in case there's a potential problem. I have people 85 years old that still have their wisdom teeth, and they're buried deep in the jawbone and have never caused them any problem. However, they are one of the things that can cause crowding. And sometimes if the teeth come in and they're misaligned, then they really they at least need a consultation about whether or not those teeth should be removed. And ultimately, third molars, wisdom teeth, are the last teeth in the arch, and they're tough to keep clean and the gums clean during one's lifetime. So like myself, I had mine removed when I was about 45 because I just was developing gum problems, and it was easier to get them out, and that solved the gum problem issue because now I could keep the teeth clean. I've treated a lot of women in various stages of pregnancy, and there's always this concern: should they have x-rays during pregnancy, or should they have any dental treatment? And the rule of thumb is usually this. In the first trimester, the first 3 months, I think it's best to avoid dental treatment at all, unless it is absolutely emergency. So if someone comes in and they've got a rip-roaring toothache and they need to have a root canal, you got to do the root canal. They have to have the x-ray, they have to have the necessary treatment to do that. But if it's optional, there are fillings, even crowns that could be avoided, or replacement dentistry. Usually most dentists like to have the woman go through the first trimester, if not through the complete pregnancy, before they begin dental treatment. And it's always a decision of, we're talking about elective dentistry or are we talking about emergency. And I'm very conservative about this. As long as it's elective, they can wait until they have the child and then come in when they're more comfortable and perform routine dental procedures. Okay. Good dental health is rarely inherited. I have seen people come in and they have not been to a dentist in 15 years. There aren't very many. They have no gum disease, they have no tooth decay, and their teeth in perfect alignment. And those people are few and far between. The reason that people have tooth decay is that they use their mouth constantly to put food in it, and that food isn't removed, even in minuscule parts. And there are some surfaces on the teeth that's very hard to get the food off. And that food eventually pokes a hole in the tooth. Now, if the person comes in and they have a lot of fluoride in their tooth, a lot of natural fluoride, these teeth are very hard. And I have a guy who I've never done any dentistry on. He comes in and gets his teeth clean, but he's got really, really hard teeth. So in a sense, that's inherited, and certainly from where he was born and raised. But most good dental health isn't inherited, it's acquired, and it's acquired through learning and visiting a dentist. The question is, does a tooth extraction affect eyesight? I have never heard that it does. I've never heard of the rumor. But here's one I have heard, that for every child, you lose a tooth. So if you have 2 or 3 children, then you lose 2 or 3 teeth. And that's not true at all. That's not true at all. Most of this relates to, you know, urban myth, urban legends that have been brought up by, that have been brought up in families, and the myth continues. Yes, I had a child and I lost 2 teeth. And it doesn't work that way. You know, no dentist can really advertise themselves as a painless dentist. Okay, and to be very honest, there can be a certain amount of discomfort, even when it's really successful and very routine. It's very noisy. I mean, I know that I'm a dental patient, so I speak as a dental patient. It's very noisy in there. We make a lot of noise. We spend a lot of time in there. But to be truly painful while the procedure is going on, no. Is there some discomfort? Yes. You know, from the injection site, but that's what pain pills are for. Root canals routinely are not painful, although most people remember the painful ones, the ones that they had a swollen face, or they had antibiotics, or they had all this sort of stuff. But most dentistry nowadays is truly painless. It's not pleasant. I'm not saying it's never pleasant for me to have my teeth drilled on, and I'll be the first to tell you that, but it's necessary. It is a necessary thing to do. Good hygiene is the basis for everything that gets recommended in dentistry. So if your gums are bleeding, then there's a reason. And the reason they bleed is if you had a scratch on the back of your hand, you'd form a scab. Well, in the mouth, you can't do that because the mouth is always moist. So if there's an infection, and it's not a scratch, but if there's bacteria around the teeth, and you put some floss in there, then that tells you that that area is infected. You need to get that flossed out and brushed until the bleeding stops, because the gum has no way to heal and the bleeding to stop when those particles and bacteria and food particles are on the teeth that the bacteria is using to create the inflammation of the gums. This is all part of this biofilm I mentioned on the teeth. That has to be removed. And so if your gums are bleeding, you need to get in there and floss them. You can use things like hydrogen peroxide, 50% mouthwash, 50% hydrogen peroxide, and rinse that and force it between the teeth, and it'll clean up the teeth and stop the bleeding. And then my recommendation is see your dentist, so to make sure that you don't have the start of gum disease. Toothpaste, I get a lot of questions about toothpaste. Should I get stuff with baking soda in it, with fluoride, with whitening agents? Toothpaste becomes sort of like cell phones. You can't get a simple cell phone. You just can't go out and get one anymore. It's always loaded with all kinds of things. Okay, so, but toothpaste is toothpaste. And probably the stuff that you get that's inexpensive, it could even be a store brand, could be Crest or something else that once they finish the Crest toothpaste, then they have all this other toothpaste left over, so they're going to run it for somebody else. So you don't really know. But toothpaste is toothpaste. You can really get your teeth clean with anything. It is the mechanical application of the brush to the tooth and the floss to the teeth that really cleans the teeth. It's not the toothpaste itself. When I was younger, I treated more children, and it was always surprising that some of the parents just let the teeth rot out of the mouth, and they got the idea that they didn't need to brush them because they're only temporary. Well, that's not true. At the earliest age, you don't really brush the teeth, but you can take gauze, and there are other products out there now where you use it and you clean the teeth with your fingers. And then a good way to educate an infant, a young child, is by good example. So when you go in to brush your teeth, then that person, you know, your little person brushes the teeth as well, but sometimes they don't do a good job. So you got to get in there and do it for them and show them how to do it. And yes, you need to brush the milk teeth, the baby teeth, because those teeth are there for a purpose. They're there to maintain space for the permanent teeth that are developing in the jawbone. And if these teeth are lost prematurely, then the space will close, so you wind up having to do a bunch of orthodontics in order to open that space back up. And if the milk teeth or the baby teeth would have been preserved, that space was there for the permanent tooth. I wrote this book, The Smart Consumer's Guide to Getting a Dental Sleep Retainer, because this is what I do mostly now. I've limited my practice to treating people for sleep apnea by making them sleep retainers. And I wrote this book because I was very frustrated when I interviewed patients, and they would always tell me that they hadn't been given the option. And so I just spoke with a woman last week who is going to take my book to her doctor and ask her why she wasn't given the option of a sleep retainer. And a sleep retainer, if you've never seen one, this is what they look like. This is one of them. They come in various types. This is a Respire Blue series, and this one is 2 parts. So there's very little covering the teeth, and there's upper and lower, and as I say in some of my websites, is it fits in the palm of your hand. Now this replaces a CPAP. This will do as much or better than using a CPAP. And most people aren't given this option. Now, I'll be first to tell you that this isn't for everybody. Not everybody can wear these, not everybody will be relieved from them. But it's more than just a yes or no answer to whether or not you can do that. There are quite a few factors that I find in a sleep study. Here's another one. This is called a Herbst, and it's a very, very nice appliance. It's got a hinged apparatus on the side. And all of these, this one and all the ones that I make are FDA approved. They're Class 2 medical devices. So let me take this off for you. So it fits nice and snug. So this is the sleep retainer. Wow. Fits in the mouth, and what it does, they all work on the same principle, and that's to move the lower jaw forward to recreate an open airway, because all sleep apnea is in, all right, so all sleep apnea happens in the throat. If you think of this as a door, sleep apnea is a door closing, so when you're completely closed and there's no open airway, then you have apnea. But there's also a part of that when the door begins to close. And what these sleep retainers are, they act like a door stop. So they keep the airway open by preventing the mouth and the throat from closing. So that's the same thing as CPAP does. CPAP blows air up through the nose, and for those of you who have them, down the back of the throat to push the airway open and maintain it. This is a much more comfortable option. Now, is it the option for you? Could be, because medical physicians don't respond to these. The reason I wrote the book is there are a lot of myths that physicians have about these. One of them is that it doesn't work for you. They always promote the CPAP. Physicians don't know if these work for you. They've never made them. And if I gave them one of these, they wouldn't even have any idea what it is. So I want you to be very careful about where you're getting your information. And that's why I wrote the book. And it's free. If you would like a copy, I will tell you where you can get one. Just go online and order it. There's no cost, and we're not going to harass you, and we're not going to share your contact information. But it's these myths. Your jaw won't move forward. Your tongue's too big. Your neck's too big. You're too old. Your apnea is too severe. The American Academy of Sleep Medicine changed their protocols in 2006, and that's 6 years ago now, recommending that people that are given the option, they have mild to moderate, they be given the option to explore about getting a sleep retainer to control that, along usually with weight loss, surgery, or CPAP. Well, I don't see people that are happy with their CPAP. I see people who hate their CPAP. I don't see the people that love them or they can't get a mask to fit. Those are the people I see. And the whole message here is really this, is it's not important whether this will work for you or not. What's really important that you treat your sleep apnea. I have sleep apnea. And I know the medical consequences of not treating it, and they're too severe. You can literally mortgage your future in the way of silent strokes that will rob your future, your ability to enjoy life as an older adult. And so please treat if you use a CPAP, I don't care what you do, lose the weight, whatever you need to do. Call me about a sleep retainer. I'd be happy to talk to you about it. Get my book, but treat your sleep apnea. That's really the message. I promised you could get this book. You can go online at gotsleepapnea.com, and you'll see my mugshot there, and there's some information for you to read. Just leave your information there, and we'll get one in the mail to you as soon as we can. Thank you. Free, free, free.